बताइए, ये कोर्स किया आपने 15 डेज, आप बहुत ही ऑनेस्टली और बहुत हम्बली बताएंगे, अंग्रेजी हिंदी कैसे भी जैसे भी आप चाहेंगे, कि when you came 15 days back and what is now, how are you changed?
Ma'am, before 15 days, good morning, ma'am. Ma'am, before 15 days, I was not having approach to how to approach to infertile couple. I was not having this approach, but now I have got the approach of both female and male, and how we have to take the history, how we have to test both the partners, what treatments we can give them, like antioxidant, role of antioxidant, lifestyle modification, weight reduction, what these conservative things we can do for the couple. And then according to the reports which couple is getting, we can plan the management. We can, according to the age, we can start with the conservative like controlled ovarian stimulation, and then keeping other pathologies in mind which the couple may have, we can exactly plan the treatment for the couple, whether it needs IVF or we can give some cycles of IUI. That is according to the age and AMH and all. Many factors are there to decide all the things. Now these all have been cleared, ma'am. And also how to set up the lab, what actually is the role of embryologist, what is the embryologist doing in the lab when it is the procedure of IUI or ICSI, semen processing, or we have to keep the embryo in cleavage media or incubator, how is the formation of embryo after ICSI, and all this, the whole role of embryologist in your lab also, it was very much cleared and it was visual, so we can keep in mind for the very long time, and it's very easy for a newcomer to start with when he or she sees the visual presentation of something, it remains in mind for a long time. And also on your lab, one thing I noticed, everything was very disciplined. No hurry was there, and all this stuff. The togetherness of 32 years of the team is showing that everyone is dedicated and everyone is very comfortable with each other. And consistency is also there. Everyone is so motivated. The effect of ma'am on the team is like that. Everyone is so motivated.
Yes.
And ma'am,
see, you can't
ma'am, all the advances which you have told me.
So आपको क्या लगता है, you are a changed person? You can call yourself very honestly that you become infertility and IVF expert?
Ma'am, if I take my interest further in infertility, definitely I can be. But as I have told you, my main interest is going for the laparoscopy. But up to IUI, I will definitely try, ma'am. And your videos of everything like IUI or ovum pickup, they are equally informative as we are attending it. You have covered in a very beautiful manner that even a newcomer, beginner who has never been exposed can understand the thing so well. So definitely these will help us in life also in future when we'll plan to do things.
Good. So yes, you are happy with the course?
Yes, ma'am, definitely. If it gave me the direction to think in a proper way.
And you will see to it that whatever is possible in India, you will speak to your couple of friends about it, that, you know, if you are enriched professionally, they should also get enriched. So, yes.
One more question, ma'am. I want to ask, what are the charges of stem cell therapy and what are the prerequisites? Like my mother is suffering from Parkinson's and depression, age-related changes. So it's very difficult for us, for all of our family members. We get very emotional with her when we see her. So this stem cell therapy session gave me some idea to think about it.
Let me be very frank. I think you have not got the concept that about stem cell therapy. It's not surprising at all, when I talk about stem cell therapy, everybody talks about their father, about the mother. Once they have had a problem, stem cell therapy is not going to help. The time to take stem cell therapy is when you don't have any problems.
Yeah,
Because
ma'am.
आपने आज स्टेम सेल थेरेपी लोगे, आपके सब पुर्जे खराब है, तो आपको उसी दिन ही आपके स्टेम सेल्स यूज हो जाएंगे, तो उसका कोई प्रिवेंटिव रोल नहीं रहेगा. सो व्हाट इज आई फील इज कि जब आपको चिड़िया सारा खेत चुग गई, उस टाइम खाने एक्शन से कोई फायदा नहीं. यू शुड टेक इट एट द टाइम व्हेन यू आर ओके. समझ आया? आपका सिस्टम काम कर रहा हो, आपको डायबिटीज नहीं हो, और डायबिटीज हो तो कंट्रोल्ड हो, और आपका हाइपरटेंशन, आपको सब कुछ उस तरह की कोई प्रॉब्लम नहीं हो, तब आप उसको लेंगे तो उसका फायदा होगा. उसका फायदा बीमारियों 10 बीमारियों के साथ लेके नहीं होगा.
Okay, ma'am. That was written 80% it is preventive and only 20% curative was the disease.
हाँ, बट अगर आप वही वाले देखो, अमाउंट तो वही है ना, इतने सेल्स गए, उसको उसी टाइम आप यूज कर लो, तो फिर क्या करेगा? फ्यूचर में कुछ नहीं करेगा. आप अकेले नहीं हो, सभी लोग अपनी अम्मा पिताजी के बारे में सोचते हैं, ठीक है, अपने बारे में नहीं सोचते. लेना है तो उस टाइम लेना है जब बीमारियां नहीं है. Am I clear? And the concept, I don't have that energy and I don't have that kind of people. मैं तो बाहर जाने वाली नहीं, क्योंकि my hands are full. But at the same time, I find, and anybody just like a cord cells, हमारी बॉडी में से स्टेम सेल्स ले at the age of 30-35, store them, and store them 2-3 उसमें. एक डोज आपने 50 साल के ले लो, एक डोज आप 60 साल की में ले लो, एक डोज आप 70 साल की ले लो. आप यंगर स्टेम सेल्स यूज करेंगे तो उसका इफेक्ट 4-5 गुना होगा. तो अभी people have to work it out, that kind of system. It is possible. It's possible. ये अब आने वाले समय में ये हो जाएगा कि स्टेम सेल थेरेपी जो है वो आप यंगर एज में इसको अपने स्टोर करें और फिर इसको यूज करें. 70 साल के में अपने स्टेम सेल्स लोगे तो वो 70 साल में जो स्टेम सेल्स हैं वो थोड़े बूढ़े होंगे. ठीक है. I hope I've been able to make yourself very clear with the stem cell therapy part of it.
Yes, ma'am.
These are the stem cells which are lying as a healing kit in your system. I'm a very strong believer कि आप अपने बच्चों का stem cells लो, your daughter, your son's stem cells, they are not going to do any anaphylactic reaction. But because of the regulations, okay, it's all right. आप HLA की तरह से उसको मैचिंग करो. But ये कुछ भी इसमें निकलना नहीं है. If you go to Russian countries, Kazakhstan and all those countries, सब आपका स्टेम सेल लेके आपको लगाते हैं, दूसरे को लगाते हैं. This is what they are doing it, and that's why the effect is seen within 15 days. The person who was crippled and takes stem cells from outside, and they feel rejuvenated. Regulations have to come. Our system is a very bureaucratic system. वो कोई चीज आई है, नई चीज आई है, अंबानी उनको थोक सा पैसा देंगे तो वो बोलेंगे जी बस ये अंबानी ही कर सकते हैं और डॉक्टर कुछ नहीं कर सकता. So we tailor made our rules for people. Anyway, thank you, Dr. Zara, that you appreciated our course and you felt that there is a sea change as far as your perception and your insight and clarity as far as IVF is concerned. Okay. Now,
yes.
Let's